Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes with Valley Health. You know, when you talk about cardiovascular disease, a lot of people think it's a man's disease. We know better these days. Women are equally at risk, but their heart factors, their heart health factors can kind of present differently. So we're talking about that with Valley Health Section Chief of Cardiology, Dr. Dan Snavely, today, about the differences between men and women in heart health. Thanks for being here.
Thank you. Thank you.
This is a really important topic. So how are men and women different when it comes to presenting for heart issues?
Sure. Well, men and women basically have the same risk factors. The thing that obviously makes them different is menopausal age. We know that there's about a decade delay in the onset of heart disease in women. There is some cardioprotective effect from estrogen. So as the estrogen wanes, we know that perimenopausal women will develop symptoms typically a decade later than men. That does not mean that they can't develop it early in
you just
life
said typically,
as well.
not all the time.
Not all the time.
Right.
So we used to think of this as solely as a man disease, but that's not true. The incidence of heart disease is actually increasing in women, and the incidence of first-time heart attacks is increasing in women. So now more than ever, it's important for women to pay attention to their health and for their risk for having heart disease.
Okay, so let's talk about paying attention. You know, men, you always talk about the clutching of the chest, the elephant on the chest. Is that how it presents in a woman, or are there other ways that really it hits women differently?
It can present classically. Certainly can present as a heaviness, pressure, elephant sitting on my chest. But what I find is women typically are a little bit tougher than men, so they will kind of
we're used to a little bit of pain.
A little bit of pain.
Yeah.
They will put up with that pain, but they may also complain of shortness of breath, excessive fatigue, sweating, palpitations, nausea. It may be symptom in their jaw or their shoulder or their back. I see this a lot, that women will say, I have this pain between my shoulder blades. So it's a little bit different, but we used to call this an atypical presentation, but I think it's just a typical presentation for women. I don't like that terminology because it implies that, you know, it's something unusual, but that's just usual for women. So it can still be the classic, but anything from the navel to the neck that affects a woman, they should be concerned about. And effort intolerance, exertional capacity, a decrease in their exertional capacity, and don't tough it out. I mean, that's what I would say, is if it's something unusual, if they are concerned, then we are concerned. And they should be more concerned than they've been led to believe. If it's something that just doesn't measure up, get checked out.
Okay, so what's your first call to your PCP? And if you have family history, do you go directly to cardiology?
Yeah, that's a good question. If they have abrupt onset of symptoms, abrupt boom, out of the blue onset, the first call is 911. They need to get checked out immediately, because we know that time is muscle when dealing with a heart attack. So that's the first thing. Secondly, if it's more of a subtle onset of symptoms, if you have your primary care provider that you have readily access to, then seek that out. If you're not getting the answers you want, or you don't get a prompt referral to cardiology, call. I would say any cardiologist in the area we're happy to see people, whether they have a referral, an appointment existing. Call if you're concerned. To get checked out. It takes almost nothing to get an EKG and for someone to listen to your story.
And to get peace of mind or get the intervention that you need.
That's exactly.
Okay. Let's talk real quickly about lifestyle changes. What can women do to protect themselves from having cardiac issues?
The number one risk factor for having heart disease is smoking. So we also know that family history, diabetes, high blood pressure, high cholesterol, those are all risk factors. But the biggest impact you can have on your health is, 1, stop smoking. 2 is become more active. People will interpret that as going to the gym and getting on the Stairmaster, but it really is simple as getting some aerobic activity. Start moving. Start moving in a purposeful manner. Get some aerobic activity, increase that as time goes. So stop smoking, increase your activity, and then know your other risk factors.
Know your numbers.
Know your numbers.
Know your numbers. All right, Dr. Dan Snavely, just kind of the surface, but something for all women to think about as we try to be a little healthier and protect our hearts. Thank you so much.
Thank you.
Thanks for checking in with Monday Health Minutes.